Thank you. Sorry for that, and thank you so much. I'm so honored to be doing so this request. Thank you. And I'm Stamatoula Tsikrika. Mother Tsikrika is my name, and I'm a chest physician. My topic is global tobacco control. What has been done until now? As let's continue. My first slide will be to declare that I have no conflict of interest. And of course, until now, what we know? We do know that tobacco is the only legal drug that kills many of its users when used exactly and intended by the manufacturers. Tobacco kills more than 8 million people each year. More than 7 million are the results of direct tobacco, and 1 million are due to second-hand smoke, and that's because of the deaths of small smokers. Over 80% of the world's 1.3 billion tobacco users live in low and middle income countries. Until now, is there any safe level of exposure to tobacco? No, there is no safe, that's a statement. There is no safe level of exposure to tobacco. All forms of tobacco are harmful. Which are they? They are cigarettes, smokers, tobacco products. They are new entry actually. Cigarillos, snuff, Bides and Grettles, pipe, water pipe tobacco, and roll your own tobacco. There is a very recent article in the literature that talks about 100 years in the making the global tobacco epidemic. And that article found that early tobacco control strategies differed from country to country regarding particular political, social, and economic situation. A major shift in policy approach to controlling tobacco occurred in the late 80s with the rise of new evidence that secondhand tobacco smoke will increase death and disease in non-smokers. In 1998, WHO had adopted 17 resolutions on different aspects of tobacco control. The same year, the Framework Convention on Tobacco Control, as the very first negotiating under the auspices of the WHO, was the very first collective response for non-communicable disease. 10 years later, Bloomer Reduced Tobacco Use Foundation supports with a lot of money project and deliver high impact evidence tobacco control intervention. Next year, WHO package and promote 6 proven measures to reduce tobacco use worldwide known as Empower. What about tobacco deaths compared with other causes? We have WHO that actually calculates that up to 2030, unchecked worldwide deaths will achieve up to 8 millions per year. So as you can see here, the tobacco death will be double and more in a lot more in numbers comparing with acute respiratory effects, HTB, or traffic injuries. What do you know, which is the relation between tobacco use and chronic diseases? So in US, about 4,800 US deaths attributed each year to cigarette use and second smoke, hand smoke. So we do know that there is tobacco use is strongly associated with coronary artery disease, with diabetes, with cerebrovascular disease, COPD, and other chronic respiratory disease, and of course, with high number and significant association with lung cancer. WHO Framework Convention on Tobacco Control is the very first global health treaty negotiated by WHO. Actually, it's the first legal instrument designed to reduce tobacco-related diseases around the world. Unanimously adopted by WHO, 192 member states on May the 21st of 2003, and then entered into force 2 years later. And actually, today we are talking about 180 countries that are parties to this treaty. And if you want to tell it correct, is 180 and all the countries through the European Union. The governing body is the conference of the parties which meet regularly and establish detailed guidelines for implementation of specific articles. The technical assistance is issued by WHO. What are actually doing the tobacco control strategies and what are they? They're making efforts to curb the availability of tobacco products and use. They make efforts to curb the use of tobacco products. They want and work on efforts to educate about the harms of the use and the harms of the tobacco industry. Efforts again to reduce exposure to tobacco and the public places, monitoring the tobacco distribution and use, and last but not least, examination of tobacco industry practice. What does tobacco control work? It works combining prevention and the treatment to reduce morbidity and mortality. Utilize multiple strategies for multiple disciplines to accomplish a single goal. And actually, are they comprehensive? Yes, but when? If they reduce tobacco consumption, if they reduce tobacco use prevalence, and if they reduce tobacco-related diseases. CDC actually announced best practices recommendation for tobacco control programs. Which are they? Are CDC recommends components in community programs, chronic disease programs such as heart disease prevention, cancer registries to reduce the rates of tobacco-related disease, school programs, enforcement of existing policies, statewide programs, counter marketing, suggestion programs, surveillance and evaluation, administration, and management. And of course, a very highlight of tobacco control strategies is legitimation. In recent years, tobacco control professionals have actually worked and win against the tobacco industry to recover damages. And of course, they are provocative from corporate behavior. Successful cases brought on behalf of individuals from second smoke produce dual benefits for public health. First of all, there is a paving the way of other non-smoking litigants can win the cases. And second of all, persuading business owners and others to voluntarily make their facilities 100% smoke-free. So, except of legislation, we have regulation on global control strategies, working on comprehensive regulation for the tobacco industry and workplace smoking bans to reduce the cigarette consumption. To expand the fight against tobacco epidemic, WHO has introduced Empower packets of 6 provided actions. Empower is a policy package of tobacco epidemic that really want to work on millions tobacco-related disease. Empower focus on reducing, on reducing demand, which if adapted at the highest level, will achieve the global tobacco control target of 30% relative reduction by 2020. So every letter of Empower correlates to an action. M is to monitor tobacco use and prevent policies. P to protect people from tobacco smoke. O to offer help to quit tobacco use. W warn about the danger of tobacco. E to enforce bans on tobacco advertising, promotion, and sponsorship. F to raise taxes on tobacco. And actually, what tobacco control programs are looking for and working on? They are focused on community interventions with combination with strong advocacy, taxation, media intervention, and evidence-based policy formation. Mass media campaigns, what I actually want us, the health professionals, to do? We want these campaign strategies to be based on social marketing principles. Target groups must be carefully differentiated. Messaging for specific target groups based on empirical evidence of needs and interests. And of course, these campaigns must have sufficient duration and time. Another topic that we have to talk about is the effective intervention to reduce tobacco consumptions, which are the measures actually to reduce the consumptions. First of all, higher cigarette taxes. We do know that this promotion really works. The other one, without taxes, is non-price measures. First of all, we have to consume the information of the consumer, cigarette advertising and promotion bans, warning labels, restriction on public smoking, and of course, we have to increase access to nicotine replacement therapy and other cessation therapies. If we want to talk about very successful tobacco control programs, we have to be focused on special population, in my opinion. First of all, we have to be focused on adolescents. The young must change the overall environment of their social context of smoking. We have to emphasize the smoking cessation among adults, even if you have to have role models for children, to expand the state, local, clean indoor air laws, to enforce illegal tobacco sales to minors, and of course, we have to be very focused, targeting in developing countries with high smoking rates. Main strategies for preventing tobacco use among youth: develop and enforce school tobacco policy, establish educational programs, start smoking prevention education very early, and sometimes, why not, we do have data for that from kindergarten. Of course, we have to provide program-specific training for teachers. We have to involve parents in support of school-based prevention programs. And we have to support cessation efforts among students and school staff who already use tobacco. And then, of course, access prevention programs on a regular basis. What we do know that every year, in the 31st of May, we have the World No Tobacco Day as a public awareness. We, the health professional, must make every day the special day for No Tobacco Day. Another thing that is very important and is highlighting the messages, because we do know that we're living in the center of image. Anti-tobacco messages can be used to increase the public's awareness of the health risk associated with tobacco use. But these warnings, do they work? We do know that more prominent packages are effective in increased awareness of health risk, promoting cute attempts, increasing cute access, and of course, graphic warnings are more effective than text warnings. We have three very recent articles. Last year article actually found that pictorial health warnings are effective in reducing smoking intention, particularly when they activate negative emotion and are paired with plain or standardized packaging. The second one, 3 years ago, a systematic review, says that pictorial health warnings appear to reduce misperception that some cigarettes are less harmful than others. And another systematic review, very good one with very detailed, actually conclude that graphic health warnings and plain packages appear to increase adolescent awareness of the danger of tobacco use. Then we have to conclude, and I have to say that effective policy and programmatic innovation are available to reduce the damage for tobacco products and the death, disease, and economic costs that result from their use, but their intervention are underutilized. Policies and programs that work to reduce the demand for tobacco products are highly cost-effective. Tobacco control does not hurt economists that someone really believes the opposite. Control of illicit trade in tobacco products is the key supply-side policy to reduce tobacco use and its health and economic consequences. The market power of tobacco companies has increased in recent years, creating new challenges for tobacco control efforts. Now, the progress is being made in controlling the global tobacco epidemic, and concerted efforts must be required to ensure that Congress is maintained or accelerated. Tobacco control and smoking prevention must be priority issues for public health, and we have to always remember Hippocrates. Prevention is more effective than cessation. Prevention activities will be targeted the young population, children and adolescents prior to smoking initiation, who have then to work all together to curb the tobacco epidemic. We, with our scientific evidence, we have to have with us political will. We have to combine intergovernmental work, international support, and of course, public awareness. And all this are we actually here in this time of point of view. We have our global control strategy. Is that a winnable battle or still an utopia? Thank you so much.